तो डॉक्टर बरार, आई वुड लाइक टू नो दैट कोविड के बाद खासकर एवरी सेकंड हाउस हैज ब्रेन क्लॉटिंग तो बहुत ही कॉमन हो गई है, तो आप बताएंगे कि व्हाट इज हाउ द ब्रेन क्लॉट हैपेंस एंड व्हाट इज द राइट टाइम कि हमें अलार्म कर लेना, अलार्म होता है कि वी शुड गो टू द डॉक्टर?
सी यस, ये कोविड के बाद में इट हैज़ बिकम अ वेरी कॉमन सिचुएशन.
जी.
After COVID vaccination also, a lot many cases are coming which are being diagnosed as brain strokes. Brain में there are very small vessels, blood vessels, जो हमारे brain को blood supply करती हैं. What the vaccination has done, it causes thickening of the blood. So the blood becomes thick and फिर वो उन blood vessels में जाके जो छोटी छोटी vessels हैं उसमें जाके वो जम जाता है एक तरीके से. So just to explain it in a very simple way, तो अगर ब्लड वेसल के अंदर ब्लड जम गया एंड दैट पार्ट ऑफ द ब्रेन इज नॉट बीइंग सप्लाइड विद द ब्लड, सो देन दैट पार्ट बिकम्स इनर्ट और इनइफेक्टिव इन अ वे. एंड whatever part is involved, whatever the blood vessel is involved and whatever part it supplies, so the part of the brain, it has certain functions. So those functions will be hampered or harmed and the patient will have some symptoms. So the most common symptoms are like weakness of one side of the body, maybe upper limb, maybe right arm or left arm, or right leg or left leg. Then patient may become unconscious. Patient may throw seizures.
Okay.
And in certain patients, they have some speech difficulties, they have some balance difficulties.
So that is a time कि हमें डॉक्टर के पास जाना चाहिए.
Yes, any patient who experiences any of these symptoms should be rushed to the hospital as soon as possible, because in case of stroke, when the blood is thick and it has clogged the vessels and the blood supply is hampered, so we need to open it up as soon as possible. So initially 3.5 to 4 hours period is there in which we can give certain injections, and after that maybe up to 12 to 24 hours we can do some surgery or something else. So that time period is crucial. So the patient needs to be shifted to the hospital ASAP, as soon as possible.
Okay. तो अगर हम टाइम पे हॉस्पिटल पहुंच जाते हैं तो वी कैन हैंडल द सिचुएशन.
Yeah, we are in a much better situation to handle the
एंड
patient.
क्या पेशेंट 100% क्योर हो जाता है?
Yes, if we arrive in time, if we save the damage to the brain. So the time is brain, so we need to rush the patient to the hospital in whatever, as soon as possible, in whatever earliest time as possible. And whatever intervention is required, whether he requires an injection or some surgery or anything else. So if that can be done within the time frame, then we can definitely save the patient, or we can at least reduce the complications, we can reduce the after effects of the damage.
After effects of the